Hello, everybody. Good evening. Good evening. Apologies. We were yanked off because of the light. Doomsa, the light, the power went out here in Ghana. That is one of the things that we would really love for the government to do here in West Africa is to fix the light and the power issues, because we were already just getting into the video and then the light went off, and when the light goes off the internet goes off as well. So apologies, we are back like we've never left. This hasn't happened, to us ever since we started Project Team live on YouTube. So really apologies. Please share the links. If you have not subscribed, please make sure you subscribe. We are about to get into the topic. Yeah. So thank you. I'm still going to leave the first half up, and I'll just quickly go into what we are here to discuss. So like I said, I just want to do, because I want it to be holistic, so I'll just do a brief on myself. I am a broadcasting and PR extraordinaire. I've had over 20 years in the industry. I've been on radio, like I said, since I was 8, 9, 10, 11, from primary school, secondary school, throughout university. From 2008, I worked with the radio station, Anambra Broadcasting Service, till I graduated. Then I worked at Delta Television, Delta Radio, and, Spice TV Africa, Radio Nigeria, amongst many other, media houses. My expertise stems from, my background as a mass communication graduate, and, which right after university, I went ahead to do my youth service, where I worked in Delta Television, Delta Radio. Then I started a school in Anambra State, Onitsha, called Primavera International School. And we actually just turned 10 years in 2024. I'm known as a start to finish coach because I aid you and assist you, in starting your projects. A lot of times people are scared. I don't know why people are scared, but people are scared. They sabotage their own great ideas. They sabotage their own potentials. They create amazing content. They create amazing product, and they are so afraid, and they never even give it the chance of the day. They never even let it blossom. They never even let it thrive. They never even let people see that wonderful gift that they have, before, without self-sabotaging it. So that is what I am here to do. I am that voice of reason that will urge you to put your best foot forward all the time. So in case you're following and you have not subscribed, I'm going to pause for a minute or two while you hit the subscribe button. In case you're just joining us, I would like you to put your name, what it is that you do, and also your location. If you're in Nigeria, if you're in Lagos, if you're in Ghana, if you're in Accra, if you're in Kumasi, put it in the comments. Let's know what you do, the name of your business as well. And I want you to take a minute to also share this link. Let's get more people to join in. Let's get more people to join in, because we are just about to get started. Thank you so much for joining in, Ben. I see you. You're welcome. So why are we doing this? Why have we spent every Tuesday, every Thursday, and every Friday in the month of October to teach Project STEM? Why? Okay, stemming from 2000 and 2022, I have I started a business training initiative called the Business Boost Bootcamp. In this training, I put together courses varying from topics in branding, business. Lately, as of 2024, cybersecurity. We've done different trainings. We've had seven editions of Business Boost Boot Camp. So this is our very first edition of Project Team, which I like to also call our eighth edition because it's also in collaboration with Business Boost Boot Camp. Project Team is an initiative that was designed and provided for youth, undergraduates, young individuals, middle-aged individuals, people that are working, looking to get a side hustle, people that that still have that wonderful idea, but they've not done anything about it. We've been teaching science, technology, engineering, arts, mathematics, skill acquisition, businesses, and all that in this initiative that has held every single Tuesday, Thursday, and Friday in the month of October. Apart from there was a particular Friday that we had to take a break, but we already did the trainings on a Thursday. So that is the only gap that we had. So far, I've had an amazing team. I've had so many amazing coaches, joining us from different parts of the world, from the United States, Canada, South Africa, Ghana, Nigeria. I've been so blessed. In fact, there are so many coaches that would like to join. In fact, we have some coaches that would love to join in all the way from Abu Dhabi, and we're going to see if we still have a slot to be filled possibly by Thursday. I just want to say a very big thank you to our coaches. I want to say a very big thank you to our participants for being a part of what we're doing. I want to say a very big thank you to our media partners and most essentially our sponsors. I want to give a shout out to our sponsors, System Digit, Oroluwa Afe. I want to give a shout out to Honorable, all the way from Abuja, in the person of, the Igwe of Nike regions. Yes, thank you so much, sir. You are amazing. We are very grateful. For those that still promise that they're going to sponsor, please, we are waiting on you. I would like to proudly stand here and say that since the month of July, in the regions of Anambra State, we have been feeding street children over 200 every single month, 200 to 300. This month we fed about 400 street children. You can go verify from Red Cross. We fed in Abakoba Park. We even went as far as Old Torcha to feed them as well. We also provided packs of rice, food, and other items. Then we did, one or two giveaways, to people that really needed it. But also we have an outreach that we are going to do in Accra. So if you like to volunteer, you can reach out to my community manager. You also need to get our t-shirts, because you're definitely going to need it, our volunteer t-shirt, so that people can identify you on that day. Yes. So without further ado, I'd like to just go into what we're here to talk about. The light, I pray it stays stable and then it doesn't cut off anymore, so that we can, discuss what we are here to talk about. Also, I have word from the endocrinologist that worked with my grandfather in the person of Dr. B. Onyenekwe, and he has been so kind to share his slides with me, share some of his slides and his documents. So I'm going to be talking a bit about, I'm going to be sharing a bit about, from him. And also, please stay with us till the end, and then it's likely we're going to get the part 2 of the digital transformation and ChatGPT prompts from Oroluwa Afe later tonight. So you don't want to go anywhere. Tomorrow is packed. Tomorrow is packed by evening, I think around 9, I think 9 Nigerian, 8 Ghana time, I think. I'm going to share the flyers in the group. We are going to be having a conversation with our coaches. So, majority of the coaches that were able to RSVP, they are going to be available right here to have a conversation with you. You can ask your questions. We are going to be talking. We are going to talk very, very deep talks and just nicely wrap up what we're doing. And then on Thursday will be our very last. If you have not done any of the assignments, I'm not going to say this, lightly. We have packages for people that are compliant. So please do your assignments. Please watch the courses. Please be very active here. We just have one more week to go and then we are done. So you don't want to be the person that was not compliant. Okay, I'm trying to see if I can pull Dr. Yenekwe's documents. Let me see. Okay. I want to see if I can share my screen. Can I share my screen? Okay. All right, guys. In case you're just seeing me for the first time, I already told you my name. My name is Coach Ndali. I want to know your name that you're watching, where you're watching from, and the business you're into. Please drop it in the comment section now. All right. Okay, I've sent share screen on two monitors. Okay. All right, let me see. It's letting me share. Okay. All right. If you can see my screen, please let me know. Can you see my screen? Can you see my screen? Can you see my screen, please? Can you see my screen? Okay, so I'm going to go ahead. I'm representing Dr. B. Onyenekwe, consultant physician. Dr. B. Onyenekwe is a consultant physician in the person of an endocrinologist, UNTH Enugu. He's assisted by Professor Dr. Ifoma Modebe. She's a consultant in public health and a public health physician in Navy Teaching Hospital. Executive summary. Malnutrition and micronutrient deficiency, which is called MMD, are prevalent in developing countries, Nigeria included. MMD contributes, which is malnutrition and micronutrient deficiency, contributes highly and hugely to the burdens of disease in affected communities. Nigeria has made good progress in its country program of IDD elimination. IDD meaning iodine deficiency disorder elimination. In 2005, Nigeria became the first African country to be certified as USI. USI means universal salt iodization compliant, after having achieved 90% household coverage of iodized salt, a level that appears to be maintained till date. However, hard data is very sketchy or non-existent concerning other micronutrient deficiency, namely iron, folate, B12 acid, vitamin A, zinc, and selenium. Suitable programs for the control of MMD must have monitoring systems that provide basic information about the program and its impact on the population. It is the vision of WHO under the revised IHR, which is International Health Regulation, that member states should have the capacity to detect, confirm, and report public health events in a safe, timely, and reliable manner by laboratory testing. The goal of this initiative is to increase domestic testing capacity in range and volume, support laboratory workforce development, and strengthen national laboratory system policies, hereby, providing strategic plans amongst others. This proposed laboratory will serve as a regional reference laboratory for the training of personnel and analysts on iodine, other micronutrients, and hormonal biomarkers relevant to process and impact assessment, monitoring of malnutrition and malnutrient deficiencies and their control, iodine, vitamin A, iron, phosphate, folate, and vitamin B12, zinc, and selenium. As of now, there is no laboratory in Nigeria as we speak enrolled in the EQUIP, which is ensuring the quality of urinary iodine procedure programs of CDC, Centers for Disease Control, Atlanta. If you look at if you can see my screen, I want you to let me know. EQUIP member laboratories. These are the countries and the states currently participating in it. And I'm going to just recap and let you know what EQUIP means. It means ensuring the quality of urinary iodine procedures. It's a program of the CDC, which is the Center for Disease Control in Atlanta. Can somebody say, I am following? Should I summarize, or do we understand? So basically what this executive summary is talking about is that it talked about, I'm going to, as I read, I'm going to summarize, okay? Malnutrition and micronutrient deficiencies. I want you to understand the severity of what we are doing. Are you with me, somebody? Are you following? I want you to understand the severity of what we are doing. We are not just here to make noise once a year and disappear. No, this has been an ongoing work, an ongoing, footwork, right? That started as of the time of Professor Louis Onoro-Victor Ekpechi, carried on by his daughter, Professor Ifeoma Modebe, his granddaughter, myself, the endocrinologist that my grandfather actually worked with. We are so privileged that he shared his documentation with us. Like I told you, I'm not a doctor, right? I'm not a doctor. I'm just the first aider and the, coordinator of Project Sting and the granddaughter of Professor Louis Onoro-Victor Ekpechi, right? So I'm going to interpret this the way I can in my own words. So let me explain, okay, in case anybody wants to know. MMD simply means malnutrition and malnutrient deficiency. So when I say MMD, I'm talking about malnutrition. Malnutrition means that nutrition means someone is nourished, someone is eating well. Malnutrition means they are not nourished, they are not eating well. Micronutrient deficiencies, right? So we are coming, it's been known that as of 2005, Nigeria became the first African country to be certified as USI compliant. USI means universal salt iodization, right? As of 2005, 90% of households, consume iodized salt till date. But like he said here, hard data is very sketchy and sometimes non-existent, right? Especially after such a long duration. So we are proposing an iodine laboratory and also an iodine library. These two things are what we are proposing: a laboratory where we can have in scientists that can come in, and come up with new concepts, new ways to inculcate iodine into our nutrients, into new ways to inculcate iodine into our daily, our daily nutrition, right? And also, I propose an iodine library where people can come in and read the backlog of work present and all that. A digitalized, 4D library that you can access from any part of the world digitally, and you can also get into physically. So this is what we are proposing. Am I communicating? Was I able to break this down well? And then we're going to talk about equip. Equip simply means ensuring the quality of urinary iodine procedures, which is a program of the UDC, Centers for Disease Control in Atlanta, or like I always call it, Atlanta. Are you with me, somebody? Can you hear me? All right. Problem statement: global micronutrient deficiency burden. Micronutrients are vital for health. They play a vital and crucial role in cellular signaling and function, cellular and humoral immune responses, growth, work capacity, reproductive health, learning, and cognitive functions. Malnutrition and malnutrient deficiencies, MDN, contribute enormously to the global burden of disease, GDB, in all populations, among vulnerable groups, women, children, middle age, the elderly, especially in low income communities of Southeast Asia, Sub-Saharan Africa. In addition, MND directly impacts the severity of the communicable diseases like HIV, tuberculosis, and measles, which are in their own right major contributors of GBD. GBD meaning global burden of disease. Figure 1 and Table 1 presents the global prevalence and the effects of MND, right? And then 1 to 2, shows you the MND, the control of MND positively impacting the health of billions worldwide. Let me break this down for you. Micronutrients are very important for your health. They play a very crucial and important role when it comes to cellular signaling, function, cellular and hormonal, immune responses. The body is a system, and it needs the different components to work together, right? It needs the reproductive organs to work. It needs, excuse me, it needs the reproductive organs to work. It needs you to be able to learn. It helps with your cognitive, functions as well, right? It helps you contribute, if you're able to, provide enough micronutrients that are vital for your health, if you're able to have them in your food, if you're able to have iodized, salt as part of your food, if you're able to take in your nourishment and all that, I'm going to tell you something. You're going to reduce the mortality rate of a lot of people in Africa. When last did you exercise? When last did you take a walk? When last did you buy fruits and vegetables? When last did you just cut up green leafy vegetables, boil some fish, add some iodized salt and eat in your house with some yam or some potatoes and all that, right? When last did you do all this? When last did you leave your house, leave your air-conditioned apartment, your air-conditioned house, and take a walk and take in fresh air, put your feet on the ground? You understand? When last did you garden, put your hands in the soil and plant things? So it's very, very important that we go back to the things that we once did that helped us stay longer. Under your feet has the nerve endings connected to different parts of the body, right? If you check the people, Do you understand? A lot of them walked around. A lot of them were nomads. A lot of them walked to the farm, to the house, and they lived very long because every single time you're making movement, you're massaging the different organs of your body. Every single time you move, every single time you get up from your seat and you take a walk, every single time you connect to nature, you connect to the earth, you inhale oxygen, you exhale, carbon dioxide. Every single time you exercise, you move your body, you're extending your life by 10 to 20, 30 years. You're extending your lifespan. You're buying more time. You're buying more life. You're buying more time on earth. So a lot of us need to wake up. A lot of us need to get up. A lot of us need to move, exercise. Even if it's 2-3 times a week, exercise. You're complaining, oh, they've taken the light. There's no light. Oh, the AC is off. Get up and walk. Take a walk. Walk outside. Exercise. Take in fresh air. Begin to eat the fruits and vegetables. Buy your time. Everybody has been given the same amount of time. Everybody has been given the same amount of time on earth, right? But with lifestyle, like Reverend David Obeli will say, with lifestyle, with making constant bad lifestyle choices, you're going to be shutting it down every single time. So guess what? You're listening to my voice. You may be listening to me today. You may be listening to me tomorrow. You may be listening to me in the next 5-10 years, God permits, right? I want you to use this voice as a voice that is calling onto the young people, onto the middle age, onto the older ones to get up, to exercise, to drink water. Drink water, drink plenty of water, eat plenty of fruits, eat plenty of vegetables. Okay, I'm going to tell you this, and I'm going to tell you this for free. It is in your hands. Good health is in your hands. I want you to look at this map I'm going to show you, right? If you take it up from the first table, it says micronutrient. The second table talks about deficiency prevalence, right? And then the third table talks about major deficiency disorders. And I'm going to break it down as best as I can. So if you can take a screenshot of my screen, please do so. Micronutrient, let's talk about iodine. The prevalence, okay, I want to open this a little bit. So the first one shows moderate iodine deficiency. That is this color. Let's interpret this, right? This color, moderate iodine deficiency. That means they are experiencing iodine deficiency, but it's not that serious. It's moderate. These are the regions, right? The next color coded is the lighter purple, mild iodine deficiency. You look at the areas, you look at the ash color, optimal iodine nutrition, and then you look all the way down, optimal iodine nutrition, you check it out. Risk of iodine-induced hyperthyroidism. You're seeing it's increasing, right? Risk of adverse health consequences. You see the areas, you see the regions. Subnational data, you see it, right? And then no data at all. So there are some gray areas. There are some areas where we've not even been able to cover and get data. All right. So sometimes you may be thinking, oh, you have this. It could just be an iodine problem. It could just be an iodine problem. You're having issues. Oh, you gave birth to your child. Your child is not very smart. It could just be an iodine problem. I'm telling you, it could just be an iodine problem. It could just be a nutrition problem. Am I communicating somebody? Is my voice too loud? Should I reduce it? Iodine. 2 billion people are at risk. 2 billion. I didn't say million. I didn't say hundreds of thousands. I said 2 billion people are still at risk of facing goiter, hyperthyroidism, iodine deficiency disorders, increased risk of stillbirth, birth defects, infant mortality. That means the child will die at birth. Cognitive impairment. That means that the child is not mentally smart. In class, they will be lagging behind. They don't have cognizance. They can't coordinate themselves very well. Iron. 2 billion people are at risk because of iron deficiency, anemia, reduced learning, work capacity, increased maternal and infant mortality. That means that if the body lacks iron, mother and child could be unalived. Low birth weight. Let's talk about zinc. Estimated high in developing countries. Poor pregnancy outcome, impaired growth, stunting. That means stunted growth, genetic disorders, decreased resistance to infectious diseases. That means that your body cannot even resist. I need you to understand. Your body cannot even resist when sicknesses come, when the cold comes, the catarrh comes, different because your body should be able to have enough red blood cells that can fight, but when your immune system is weak, what happens? When you lack vitamin A, 254 million preschool children are going to face night blindness, xerophthalmia, right? Increased rate of mortality in children, that is by or unalive, pregnant women, when you lack vitamin A. Folate, which is vitamin B12, insufficient data. We don't have enough data to let us know or let you know how many people lack this. Megaloplastic anemia, neural tube and other birth defects, heart disease, stroke, impaired cognitive function, depression. Do you know how many young people have been suffering strokes lately? Do you know how many young people? I don't even. Do you know how many young people are depressed? It could just be a nutrition problem. It could just be a nutrition problem. Do you understand? Oh my goodness. Cobalamin. Can somebody say cobalamin? Can somebody say cobalamin? Vitamin B12. I'm going to tell you this and I'll tell you this for free. There's a tablet, a pack. It doesn't taste too nice. They're called the B12 tablets. Buy it. Buy it. Buy it. Take it daily. Take it daily for 14 days and tell me how your body feels. It's going to begin to regenerate. Regenerate. Can somebody say cobalamin? We don't have sufficient data. Megaloplastic anemia associated with Helicobacter. Like I said, I'm not a doctor, right? Helicobacter pylori-induced gastric atrophy. Oyibo, anaso, glory. Anakuko aka here. You have thiamine, vitamin B1. Again, we have insufficient data estimated in developing countries and in famines, right? Famines where there is lack of food and all that, because they are experiencing drought, war, and all that. It's very common where they have displaced persons. You have beriberi, which is, you have cardiac and neurologic. You have Wernicke and Korsakovic syndromes, alcoholic confusion, and paralysis. This is my favorite, riboflavin, vitamin B2. Again, we have insufficient data estimated to be common in developing countries and in famines and in areas with displaced persons, non-specific, it could cause non-specific fatigue, eye changes, dermatitis, problems with your skin, brain dysfunction, impaired iron consumption. Let's move on to niacin, which is vitamin B3. Insufficient data estimated as common. You see why we need a lab. You see why we need a library, right? You see why we need all these things. Insufficient data estimated as common in developing countries and in famines and places, areas with displaced persons. We have pellagra, dermatitis, diarrhea, dementia, and unalive. You already know. Vitamin B6, insufficient data estimated as to be common in developing countries. We have dermatitis, neurological disorders, convulsion, anemia, elevated plasma homocysteine, right? We have vitamin C, common in famine and displaced persons. You have scurvy, fatigue, hemorrhages, low resistant infections, and ammonia. You have vitamin D, widespread in all age groups, low exposure to ultraviolet rays of the sun, rickets, osteomalacia, osteoporosis, colorectal cancer. You have calcium, insufficient data, estimated to be widespread. You have decreased bone mineralization, you have rickets, you have osteoporosis, you have selenium, which is insufficient data, common in areas like Asia, Scandinavia, Siberia. You have cardiomyoplasty. You have increased cancer and cardiovascular risk. You have fluoride, widespread increase in dental decay and affects bone health. Micronutrient prevention, control, and strategies. The measures adopted through education, dietary modification, and food provision, agricultural intervention, supplementation, and fortification to increase the content of an essential micronutrient in a food representative of whether the nutrients were originally in the food before processing or not, so as to improve the nutritional quality of the food supply and to also provide public health benefits with minimal risk to health, either alone or in combination. Oftentimes, more than one nutrient deficiency coexists, making it necessary to adopt simple approaches that elevate and address multiple micronutrient nutrition, which is called MMN, multiple micronutrient malnutrition, multiple micronutrient malnutrition, MMN. Iodine deficiency disorders, IDD. It is estimated that the iodine deficiency affects. It is estimated. Are you listening? That iodine deficiency affects 13% of the world's population in more than 130 countries, putting 2 billion people at risk. Other deficiencies may interfere with iodine utilization, perchlorates, block support of iodine by NIS, which is the sodium iodine supporter, severe iron deficiency, reduced in TPO activity, and all that. I'm going to skip all the technical terms. Like I said, I'm not a doctor. Okay, so universal salt iodization is defined as when all salt for human and animal consumption is iodized to the internationally agreed recommended levels, adopted by World Health Assembly in 1993, is the main intervention strategy for the prevention and the control of iodine deficiency. This program has remarkably improved the global iodine nutrition status over the past decade. I'm going to take this again. Universal salt iodization, USI, right? Defined when all salt for human and animal consumption is iodized to the internationally agreed recommended levels as adopted by World Health Assembly in 1993, is the main intervention strategy for the prevention and control of iodine deficiency. This program has remarkably improved the global iodine nutrition status over the past decade. Like I said, this is a movement. It didn't start today and is not stopping now, okay? WHO, the World Health Organization, estimates that more than 2 billion people have adopted the use of iodized salt in the last decade, during which period the population of the world with access to iodized salt increased from 20% to 70%. However, 54 countries out of 126 still have inadequate iodine nutrition, right? The 23 million babies each year globally are born with inadequate iodine nutrition, and one third of the world's population still remains, at risk, mostly in the poorest and economically least developed countries. In Africa, adequate iodine status has been documented in 30 of the 54 African countries. 8 countries have achieved successful iodized salt programs with a household coverage of more than 90%: Burundi, Kenya, Nigeria, Uganda, Tunisia, Namibia, Zimbabwe, and Libya. But 11 countries are still iodine deficient as of 2013. Let's talk about iodine deficiency. Let's talk about iron deficiency. Iron deficiency and iron deficiency anemia are prevalent in both industries. If I'm going too fast, please let me know. If you have a question, if you're stuck anywhere, please let me know. I hope you can see my slides clearly. Iron deficiency and iron deficiency anemia are prevalent in both industrialized and developing countries, affecting all age groups, especially children, women, and the elderly. It affects a third of the world's population. Iron deficiency anemia is also associated with other nutrient deficiencies, such as, we have folic acid, vitamin A, vitamin B12, which will lead to malaria, intestinal parasitic infestations, especially hookworm, right? Schistosomiasis and amoebiasis, and chronic infections such as HIV, cancer, and tuberculosis. The yellow regions, areas pertaining to high risk micronutrient deficiencies. You have iron deficiency, you have vitamin A, you have iron deficiency, which is the orange, the light orange, you see vitamin A, iron deficiency. Then the darker orange, you see iodine, vitamin A, and iron deficiency. So it breaks it down. You can see the different areas and the different colorations on the map, right? Let me see if I can increase it so you can see clearly. So the areas with the light yellow, those are areas that have slight like iron deficiency on its own. The one with the deeper orange with the light the orange that's a bit darker is showing you the areas that lack vitamin A and iron deficiency. Then you also have the deep orange, shows you areas that lack iodine, vitamin A, and iron deficiency. All right. Anemia as a public health problem by country for preschool children. Okay, if you look at this, you can see different regions and all. I'm going to see if you can take a screenshot. You see that this is a real problem, especially for preschool age children. Anemia. A lot of times these statistics show you things that are to come, and the rate in which we are consuming these things. And there's always a time to have, it's always a good time to have a wake-up call, to improve on your health decisions, your nutrition, and all that. What are the control measures? Right, of iodine? The control measures that we have if you are experiencing IDA, iodine, vitamin A, and iron deficiency. Control measures: you have to consume fortified foods, commonly eaten staple food. You have to make sure that the pregnant women and the children are, taking measures to prevent parasitic diseases and common infections. Let's talk about vitamin A deficiency. I think there's so much. I really wish Dr. B Onyenekwe was here to take this slide because it's loaded. It's about 18 different pages, but I am going to try as much as possible because we have our next speaker coming on. I'm going to try as much as possible to take. Oh, there's so much background work. Like I'm so glad that I'm showing you this because this work on iodine deficiency (IDD) is like a bit is not a joke. We are not playing. We are not playing in any single way. So let me just skip and move to the proposed micronutrient laboratory. The goal is to serve as a regional reference laboratory for the training of personnel's analysis of iodine and other micronutrients. It's going to also take on hormonal biomarkers prevalent to process and impact assessment and monitoring of micronutrient deficiencies and their control. In addition, it should be able to array serum levels of hormone relevant to everyday clinical practice. What are the objectives? Laboratory analysis of biological fluids, of biomarkers of micronutrient deficiencies and diseases to assay serum levels of hormones prevalent to everyday clinical practices. Micronutrient iodine, talking about the urinary iodine UI concentrations for determining iodine status in populations. You have salt iodine concentration for assessing the adequacy of salt iodine. You have serum thyroid stimulating hormone concentration for assessing the thyroid status of newborns. You have serum, thyroglobin, which are concentrations for assessing the severity of iodine deficiency and impact of USI. Hemoglobin concentrations for the diagnosis of anemia and assessment of severity and all. So you just go through this. If you can take a screenshot, please do. Other hormones and related substances. You have the pituitary growth hormone, you have prolactin, ACTH, LTFST, FSH, you have thyroid, you have free T4 and T3, you have thyroid peroxidase, you have anti-BD thyroid stimulating immunoglobulin, you have thyroglobin, antibody, you have adrenal cortisol, you have testosterone, estrogen, progesterone, progesterone, and all that. You have insulin that with regards to your pancreas and all that, right? Training of personnel in the laboratory, techniques and interpretation of results in line of the WHO objectives. The laboratory will be, if you're following, please can you let me know you're following? If I'm speaking too fast, please can you let me know? If you have any questions, please can you let me know? If you can hear me clearly, please can I see some fire emojis at this point, okay? The laboratory will also engage with such activities at the country level, including development of technical resources, training materials, tools, and guidelines, organization of trainings, workshop, meetings, and conferences to support public health laboratory networks through, knowledge sharing, training, or the provision of external quality assessment schemes. Technical assistance to public health laboratories through the procurement of essential equipment and supplies, or transfer of knowledge and technologies through laboratory partnerships and twinning projects. Test methods and instrumentalization. Iodine in urine. Ammonium persulfate digestion. Let's talk about if you can see this, I would like you to take a screenshot. So these are the test methods and instrumentalization. Iodine in urine. Okay, you're going to see the different aspects. You're going to see water purification system. You're going to see dispensers. You're going to see electronic timers, stirring hot plates, and all that. Chemical standards, water purity, and all. Iodine in salt, right? You're going to see WYD iodine checker, iodine. I want you to just take your time and read all this. Okay. So this is the checklist for proposed initial activity preamble. The first ever UIE survey in Nigeria was in 1998 and was conducted by the UNTH team consisting of Professor OLV Ekpechi, consultant physician, endocrinologist. We're going to be talking about currently Dr. Belongu Onyenekwe, consultant physician, endocrinologist. We're talking about Dr. Ayu Umba, consultant physician, clinical pharmacologist. We're talking about Dr. Anthony Obonna. Let's give them their roses. Consultant physician, endocrinologist. We're talking about Dr. Desmond Ohebulam, medical laboratory scientist. We're talking about Dr. DFE Magwest, statistician. Over the years, the laboratory has become dormant due to the lack of support and lack of reagents. So some other members of the old team have gotten involved with other things. Other core groups have emerged from the ashes to resuscitate the laboratory because of its strategic importance in the control of MMD. The new team consists of Dr. Belongu Onyenekwe, consultant physician, endocrinologist, and Professor Ifeoma Modebeni Ekpechi, consultant physician. Securing space assembly of equipment and materials. I'm talking about securing a space, a house for a laboratory, medical research laboratory. All sites UNTH Enugu is been done. We have space, we have a place we can use as a laboratory in Enugu. Inventory of available serviceable equipment. We need a Spectronic 20, right? Inventory of available stock of reagents used up or expired, and all that. We have, if you like to get access to what we need to put together our laboratory, please reach out to us. Send us an email at projectsteam@outlook.com or Louis Loveness Foundation at gmail.com. Preparation for a pilot study to run in the procedure of UIE, practice run on harmonization of procedures. We have, questionnaires ready. We have the specimen, receptacles ready. We have, different things, declination of subjects and all that, location, which is in Chatancha, in Emene, in Enugu, ultrasound examination, thyroid glands, and all. So okay, so we're getting set to bring in our second speaker. Hold on. Okay, so we also have, we have all these references: Maria Anderson, Balcom, Michael B. Zerman, global iodine status in 2011, trends over the past decade, Zofa Buta, Rehaina A. Salam, J.K. Das Meeting. J.K. Das Meeting the chat. If I murdered your name, please forgive me, okay? These are very new names to me. Meeting the challenges of micronutrient malnutrition in the developing world, Dr. Med Bull. You have Alan L, you have Du Bois, you have no, I give you all your credits. I give you your credits for all the wonderful work you've done. You have Okolo C, you have Ebechi OL, you have there's a shout out to NAFDAC as well. There's a shout out to Nigeria Demographic and Health Survey, Federal Republic of Nigeria 2003. The reference to Nigeria Food Consumption and Nutrition Survey 2001 to 2003. Onyenekwe BM, Ogbonna AO, Mba AYO, Hebulam D, Nwagbo DFE, Epechi OLV, Impact evaluation of the impact evaluation of the Universal Salt Iodization Program in Nigeria, 1997, UNICEF Consultancy Report, Ebuta J.O. Consultancy Report on Iodine Deficiency Disorders in Nigeria, report prepared by UNICEF Nigeria, 1993. You have Ebechi OL pathogenesis of the endemic goiter in the eastern regions, Prince J Nutrition in 1967, 21 subsection 5, 37 to 45. There's so much. You have Nicola M. Lowell, you have Catalin Fekete and Tema Deski. You also have the methods, who went through the methods of assessment of zinc status in humans, a systematic review. I want to give a shout out to, the people that contributed to making this a reality, WHO, serum, with the topics on serum retinol concentrations for determining the prevalence of vitamin A deficiency in populations, WHO serum and red blood cell phosphate concentrations for assessing folate status in populations. Okay, so there's so much giving the United Nations University a shout out as well. National Agency for Food and Drug Administration and Control, Nutrient Initiative, NAFDAC, sustaining universal salt iodization through policy and institutional behavior change advocacy in Nigeria, Abuja, NAFDAC 2010. We are also going to reference NBS, UNICEF, UNFPA Nigeria, monitoring the situation for children and women, multiple indicator cluster survey in 2011. The main report was done on the multiple indicator cluster survey in 2021. I want to thank you all for your time. I'm about to welcome the next speaker. If you can see me, if you still can hear me, I want you to let me know in the comments. So let me send the link. I'm about to invite my next speaker. She is going to be continuing the conversation that we started last week. She's going to be continuing the conversation that we started last week, which had to do with digitalization and all. So I'm going to go ahead and send Coach Orolua a link to join in. Okay, so please stay with me. Don't go anywhere. I'm very excited to present to you my branding essential workbook, but I'm going to talk about that in a bit. So let me send the invite link to one of our wonderful sponsors, my childhood friend and our coach for tonight. So just give me a moment. Hold on. Okay, I just send the link. Guys, are you following? Are you following? This is the very last week for Projects Team. I want to quickly go get a charger, right? While you're learning, you can also grab a drink. You can grab, something to chew because we have a lot planned for you today. Like I said, this is the very last week for Projects Team. After this week, we are wrapping it up. This is week 5. This is the very last week in the month of October. So just relax for a few minutes, and then while we wait for, Coach Orolowa to come into the building. All right. Welcome, welcome, welcome. How are you?
Hi, I'm good, thank you. How are you?
Oh, I'm doing wonderful. I'm doing wonderful. We just finished. I did a presentation in place of Dr. B. Onyenekwe. He was an endocrinologist that worked with Professor Louis Honore, my dad. He's, alive and kicking. And I did a presentation with regards to our iodine laboratory, and also possibly an iodine library and all that we are working for in the future. But you're welcome. You're welcome. How was your day?
Very good, thank you. Yours?
Wonderful, wonderful. I've been running around trying to do so many things at the same time,
I
but I'm
can
glad.
imagine.
Yes, and this is our final week for Projects Team. There's so
Yeah.
much. There's so much I want to, so much sleep I need to catch up on, and so many things I need to do. But from the
Okay.
first till now, it's not been easy.
Well,
You
go
know.
girl.
Uh-huh. I've learned. We'll see how next year will be. Okay. So, you're welcome. So today, I know you would like to be continuing on digital transformation and chat GPT prompts like we
Yeah.
started last week, right?
Mm-hmm.
All right. So this is Orolua, my childhood friend. She is a very wonderful person. She's one of our sponsors and our coaches as well. She is, into she's one of the few people I know that wears so many hats. She's into, I'll say data analysis, but I know she's going to correct me shortly. But she's going to take us. She's into digital transformation. She's now a tech person. She has left us in the art realm. So I want to just lend her the microphone so that she can take us deeper into the course of
Okay.
yeah of her destination. Thank you.
Okay. Hi guys. I don't see anybody's face except Ndali's, but I'm assuming you're hearing me and listening in. And I'm happy to be here. I love talking about what I do. I love what I do. I don't think even while I was in the arts, I liked it as much as I love what I do right now.
Really?
Mm-hmm. True. I think it's God has a way of just positioning you, moving you through things until you get to a point where you are like, I think I was made for this.
Mm,
Yeah.
I know what
So,
you mean.
being in tech, you don't in Nigeria, the ideology I grew up with, because everybody in my house, all my siblings are all tech people, and like my two brothers are engineers, my sister is industrial chemistry, like they're all tech people and in sciences. And being the only art person, I always grew up with this
Sciences.
thing about art science, and like, there's this superiority thing around it. But living in Canada, I've seen that it's really not, like, it doesn't work that way. Depends on the way your brain works and
Mm,
your experience, how much you're willing to research and grow. And that's the attitude we all need to have, as entrepreneurs. I believe we all know this movie producer, Steven Spielberg,
sure.
the guy that produced the Transformers. The guy not produced, but
Director.
he's the director of Transformers, and that guy has been around for a very long time. You would think that someone that old and that experienced or that jaded would be jaded, that
Mm,
he would have, people would, he did well.
outdated.
So I'm
He's
telling
moving
you,
with time.
he's moving on. If you see the 2024 Transformers, it's blew my mind. It's so
Wow.
interesting. I was still thinking about it the next day. It's just opening your mind and being able to keep moving, keep moving, keep moving. Stop thinking, oh, it's for children. Keep moving, and that's how we should all aim to be. That guy is one of the top 10, top 5 directors, even now, even though he's an old timer. So that's the goal. Don't get tired. If you get the day you get tired of moving,
Mm,
that's the day you die. So without further ado,
exactly.
I will go on and share my screen to present to you
Okay.
um my presentation. I started last week to talk about how digital transformation is important to you and the benefits that it brings to you. I had the same issue today. Just
Can you see like the present button with the cross?
yeah, I see it. I see it, but it looks like my okay. It looks like there's a setting in my system.
What is it saying?
It's not really. It's not saying anything, but it's not letting me share my system. It's wanting to share Chrome instead of.
Chrome.
Yeah, it's wanting to share my. It's wanting to share my
Your
internet
screen.
browser. Instead of sharing my screen, it's wanting to share my internet browser.
I guess maybe it's because this is on Chrome. I'm streaming from Chrome. I don't know why it's
Okay.
saying.
I should still be able to share. On Friday, I was able to share without any issues.
So if you click on that present with the cross sign, what is it showing? Is it showing you slides, extra camera, video file, and share screen?
It's showing me. It's showing me slides, video file, share screen. I'm
So
selecting
click on
share.
slides.
Oh, okay.
No, click on slides.
Okay, I see.
Click on slides. If you go to share screen, it will want you to share your screen, and
Mm,
then that's what I was using to read from the PowerPoint.
okay, I just clicked on slide. It looks like it's showing it now. Right? I think you should be able to um like
Let me
present
see.
it
Yes, I
larger.
think it's popping up now. Hold on. Okay, I just added it.
Okay.
Hold on. Okay, I just added it right now.
Okay.
Let me mute.
Um. Are you? Can I continue?
Please go ahead. The floor is yours.
Okay. So, uh, so I don't believe I. Okay. So well, I gave a little reason. The reasons why. So if you Google digital transformation, you see so many reasons why people you need to do it, and but most popular references are for larger companies. But there's a lot of benefits for okay, later. Okay, there's a lot of benefits for I'm in a meeting. Hold on. There's a lot of benefits for sorry about that. There's a lot of benefits for small businesses because it allows you focus on your customers, because we all know that, and I think but most times we forget, the customers are the reason for your business, not the money, not the not anything else, not the visibility it provides you, nothing, just really your customers. If your customers aren't there, and I'm sure that you already know that, if your customers aren't there, there's nothing you're doing. I mean, so one of the main reasons for digital transformation, one of the things it does for you is that it helps you to improve your ability to relate to your customers because you now know them. So that process is really going from improving, is really going from digitization to digitalization and then to digital transformation. So you can't go from this from nothing to just digital transformation. So where we start from as a business, for every business, is being able to capture your information and your data, being able to present your business, being able to know your business from a data informed angle, so that you're not just you saying, oh, I know madam this, I know madam this. What you have data, you capture data, you store your information in a particular structure so that you're able to make informed decisions by informed decisions that are data driven, you know and then so I said that we start from digitization, then to digitalization, and then to digital transformation. So digitization is being able to convert your data from paper based, or from sentences, or from your diary, or from however you capture it, into a structured method, like in Excel, just in a way that is easy to process, in a way that you can plug it into any system, and artificial intelligence supported system, and you know and use that information and process that information and make decisions. For example, if someone comes to ask you, you want to present something to funders or sponsors, you want to be able to tell them 60% of my clients, um 60% of my clients travel within so times. 75% of my clients are within so-called this age range. Sometimes it looks like you're disturbing your clients to ask them for certain information, but it's not. And based on your services, they will see that you're making decisions, you're capturing information about them. That information about them is important, and that they're not just one of the statistics. You're making decisions that show that they're important to you. So then we go to digitalization. Digitalization is simply, when you've collected this data, you've converted historical data into into a digital platform. Now digitalization is now ensuring that the process of keeping records, that you're actually forming a structure around what you're doing. Like, if you have some, it's not just going to be today. No, back, please go back. It's not just going to be today you collect your yeah, can you still go back? I'm still, yeah. It's not just going to be today you start the digital data collection, then tomorrow when you want to write and get another data, you go and write it in your diary. No, digitalization means the process of continuing in digitization. So you're not just doing things for want of, you're doing it as a consistent and continuous process. It's you're improving your ability to deliver in that way, and you're delivering in that way consistently. Anybody that you're employing that's coming to support you, they are doing and capturing your information in that way. It's not just about you doing it once. You're training your staff to work that way. You're doing everything you're doing is in that way. If I want to know anything about your business, there's a place you've already studied because you're improving and continuously working in that way. Then you come to digital transformation, which is the processes that you set in place. So it's not just, oh, we know we do this, oh, we know we do that. Digital transformation, I say, okay, now we can see who our clients are. How do we make sure that we prioritize them? How do we make sure that all the things that we've collected, we are doing it in a structure? We're capturing it in a way that we're able to plug it into this. What are we using that data for? Are we using it for prospecting, for funders? Are we using it for how we address or develop our services, our products for our clients? Are we using it, like there will be so many things? Are we using it to track trends, for how our business does, how our clients have been doing? Then we'll be able to use all this information to then develop a system that works for our clients, so that our customers are seeing us as without them, I can't even be in this market. Let's say what you do is that you, like Ndali does, skincare. They're like, if I'm not talking to Ndali, I'm not doing skincare, because they make you feel, because you know them. When you're talking to them, from, so it's left to you as an entrepreneur, as a business owner, to think about how the kind of questions you
How
can
to make them dependent.
dependent on you. What kind of questions are you going
Yes.
to ask them that you can document, and in what structure can you document it that it will show that you know them? You're asking them questions other people don't ask them. You're asking them how old they are. You're asking them where do they live. You're asking them what kind of cream they've been using. What do they eat?
You're asking them, what do they, one thing I always ask is, what are they allergic to?
Do you see things that
Yes,
other people won't
yes,
ask
what
them?
was their record with skincare? What have they used before? Have they ever experienced allergies? So these are things you don't just come and say, okay, oh yeah, take this product. No, you need to
Yeah,
understand their skin type.
exactly.
There,
And
there was
then,
one case.
mm,
There was one
yeah, go on.
case. There was a lady that reached out to me, and then she was like, she wanted to get products. I said, okay, no problem. I sent her an analysis form. I told her to fill the form. Now, when she
Mm.
fills the form, we'll respond to her. She reached out, was it a week later, and said, oh, that I didn't check up on her. I said, I asked you to fill the form. We can't just give you pricing without you filling the form. I need to know you. I need to know what you're reacting to. I need to know what you're trying to solve. So she filled the form and made the payment. And she was like, oh, I didn't chase her around. I was like, it's our policy that you fill the form. If I just wanted it to, oh yeah, take, I would just say, oh yeah, bring money, take, and be going. And then you
Mhm.
now wake up tomorrow and say, okay, I don't know. But if tomorrow she reaches out, I have her database. I already know what she's allergic to. I already know what she needs, and I already know how I can serve her. So, like you said, I think this is very key. Even in the skin, even in branding as well. Before I brand you as a company, I send you a form. You fill it up, and then I can know, where to take it and know where to, how it progresses. Let me allow you continue.
So, so that even buttresses my point, because over time, when you continue to ask people those kinds of information and you're storing it in a systemic way, you're able to now say, okay, people that have this kind of history, these are the products that work for them. So you're making informed decisions. Now, the kind of organizations that usually do digital transformation are people that are looking at how they are going to better their customers' lives, how they are going to make their customers better measurably, you know, measurably, not just, oh, my skin is good. But how do we know how your skin was? What are the parameters that we're using to measure good skin? Is it just because it looks good, or because you now turn yellow, or because your spot has gone? We are looking for KPIs. Over time you start to build it, and that's what I mean by structure. And then how can you start? First of all, you want to start looking at the kinds of people. You want to start looking at how you want to start looking at your people. You focus on people. You focus on the kinds of technologies you can leverage to be able to document the kinds of people. I'll start with one, Excel. How do you Excel is something that's common. Everybody has it. Once you buy a laptop, you have Microsoft Office. You have all the Microsoft Office soft applications, so you're able to just use your Excel. You start capturing KPIs one by one. When I mean KPIs, I mean key point index, that helps you to track it by knowing how many people, by knowing the kinds of things that people, the kinds of things that you've captured over time. It helps you to make better decisions because you have a group sample of people. Then you're looking at, then you start collecting. Then from people, the kind of people you're working on, you start collecting information about them. So let's say today Ndali collects, analyze, and she provides people an analysis form. Tomorrow, based on some certain kind of information, certain kind of training she has done, certain kind of people she has met, she will add to the analysis form. She'll remove some things. She'll start adjusting. She'll start looking for measurable questions, open-ended questions, questions that can indicate yes or no. So in your Excel, you're looking at yes or no questions. No, 0, it means 0. 1 means yes. You're improving on the way you're capturing your information. You're capturing information in this way so that it's easy for you to feed into any technology and deliver results to you, so that you're able to automate your processes. Then your insights are a result of you combining, leveraging the data available to you and the people available to you. You're using those insights to now build processes, improve your processes, improve your engagement with people. The actions that the actions are all these things, the things that you're doing to, to make your interactions, your engagement, your delivery better. Your delivery, the way you deliver your services better. But I'm not even just talking about, when I'm thinking about this, I'm not thinking about just internally how you attend to your customers. That's a long-term effect. But mostly how you prepare yourself in this global economy to easily and more confidently reach out for funding. Because everywhere all over the world, entrepreneurs are not looking for how to do their business. Yeah, it's good to grow your business organically, but only for a short time. You can give yourself a few years to know your markets, gather your data, work your data, leverage your data, see the results that your data can present. But after some time, you're expected to start reaching out for big time funding. Look at the top 30, 100 businesses globally, even in Nigeria. They're not using their money. They're not using the money they got from organic growth to be able to expand their business. They didn't grow that big because they're using their money or the little proceeds they're receiving. No, you are positioned. You have to, digital transformation helps you to position yourself to play in the big leagues, meaning that you're seeking funding. And when you're seeking funding, like I mentioned on Friday, you go for something like Dragon's Den, and the other one you mentioned, Ndali.
Shark Tank.
Shark Tank, yes.
Oh my
you go
goodness.
like Shark Tank.
Was my mic open?
No. Well, I think so. Yeah, I heard a little bit.
Okay, I was trying to share the live on Facebook and all. Sorry.
Okay, no worries. So you want to be able to go there and they ask you something like, so how many people in your mention, what's your success rates? What are the trends that you're seeing in this sector? You don't know how you say, I've noticed that people like shoes. I've noticed that when they wear shoes, they like high heels. I've noticed that usually people like black leather shoes that don't scratch. No, that's not what they're asking you. They're asking you for numbers. So when you're asking those kinds of questions, you're going by numbers. You're not going by giving them story. They will just So digital transformation positions you and puts you in the right frame of mind to be able to answer those questions that people want to know. So those are the actions that you're taking. You're positioning yourself to play in the big leagues by practicing digital transformation now. and then being able to quantify your results at what I just said, being able to quantify your successes, being able to observe trends, and then mitigating issues or gaps that you've observed from the trends that you're seeing, Now, what are the two things? Because I like to be very practical. The two things that you can start from today is, start documenting your things in the cloud. Things like Google Cloud, um, even Microsoft. It can leverage, but most times Microsoft will ask you things to bring. The money they will ask you will be a lot, except your crowdfunding, which is a number of businesses can come together. You do a family package, or a business, you do a family package, and then each person has one. All of you have access to the accounts. You all have your passwords, you all have your privacy, but that's one way you can leverage Microsoft if you're a Microsoft person. But you can also use Google. If you have a Google account, you have a Gmail account, start to store your documents in Google so that it's easy for you to share a link with someone. And then start optimizing data collection, so that you're able to clean your data. Optimizing data collection means that when you get this data, you want to put it in a structured way, so that when when you need to analyze and collect certain things, or put it into ChatGPT won't understand if you don't structure your data. It's built to respond to certain to information provided to it within a certain structure, and you produce results based on a certain structure. Now, what I can guarantee you as an immediate result is that you will know your markets, you will know your people, you will know the people, you continuously improve on your target markets. When I was doing, I've done a few businesses, and I can tell you, sometimes you start out not knowing exactly who your target market is, and because of that, it can kind of it can make a mess of it. It will make you feel like you're not doing good enough because you're targeting the wrong people. You're going to them at the wrong time. You're not presenting how you can help them in the way that they can see your value. So knowing your market, at least as at today, with those numbers, will help you continuously improve. And then knowing your markets will show you how other people are doing. It will help you predict what other people will certainly are likely to go for, and you'll be able to be ahead of them. I mean, we're trying to be healthy competition with each other, but that can only work if you're doing well. If you're not doing well as a business, your competition will be aggressive and bitter because you're already not a happy person, because angry people hurt people, and that's the end of my presentation. I'd like to take a few questions before I move over to, I'd like to show you a few practical things that you can start to do today.
Okay, so Miracle, Ben, please, if you can hear, if you have any questions with regards to digital transformation, please drop it in the comment section so that we can take your questions. This is the part 2 of digital transformation. It started last week. So if you missed last week, you might want to go back and catch the beginning of this course on digital transformation. Okay, so I know so far we have Boluwatife. She's a virtual assistant. Then we also have Ben. He's into business networking. So these are the two businesses. No questions. Is there any question? Someone says yes. Okay, please, if you have any question, Ben, please can you type your question in the comments? Okay. Ora, can you see the question?
No, I don't see questions.
Okay, so he says, I am planning on digitalizing a relative's business. Okay, so what's your question? What will be your, hold on, let me take it. What will be your suggestion on the first step to take?
Oh, so how much information does your relative currently collect? You want to document that information in an Excel workbook. That's one way that you do that. You want to be able to have the information all in one place. So it doesn't matter in what structure it is right now, even just have them in one place, and then begin to categorize them. So in your Excel spreadsheet, you can create different tabs. So when you just put all of them in one place, first of all, and then start to sift through that information to figure out where does this one, what category, start to create categories. Work with her or him to create categories on the kinds of how they want to umbrella, how they want to um 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 pull all that information. Do they want it to be customer centric? Do they want customer based information, um um addresses, all those kinds of things? Start to pull them in different ways. It's a continuous improvement process. It will continually improve, but just put them in one place and then start sifting through to categorize, and then you start to structure your data. So if say they have things like, it depends if they are online and they have information about their customers online, like the kinds of people that go on their website, or if they are in person, like they have a store. um Gather all that information and put them. You have to first of all type them, transcribe them first of all. But it's a good yet daunting task depending on how long that business has been run.
Has been in existence. Okay, he typed
Yeah.
something. He said, the areas he would like to digitalize. He wants to digitalize daily transaction, sales, bookkeeping, records.
So there are softwares and applications for that, that are free or very cost friendly. You want to
Okay,
leverage those ones, those bookkeeping ones. Most of them are usually not addressing one problem. They are working, they'll help you create your
together. I think I
invoice.
have an.
Yeah. So they'll help you do all those things
I
and you
think I
have
think
all those things.
there's one B. You can try download B's invoice. I think I have it on my phone. Just give me a moment. Bees is very good. You can do your invoice. You can, it's and also it's if you like to if you need to send people a message with regards to products that they've bought, and let's say they need to balance you, it keeps a very good data.
Mhm.
This is I use that's what I use for hazel oil, and you can add different logos. I use it when I use it with hazel oil, I can add the hazel oil logo. When I use it with Dame Media, I can add Dame Media logo and all that. This is what the app. I don't think you can see it, so maybe I'll just post it in the group. But B's invoice is it's called Invoice B. It's really good. Another thing I can suggest is my business planner. It contains your invoice. It contains, it helps you with your bookkeeping. I think you are supposed to get it. I don't know if you've gotten yours yet, but this also is very good for business owners. Trust me, at the end of each month, I can easily go and say, okay, I made sales here. I did this. Okay, this is what I need. Like it helps. This is your surest bet, and it is online. You can get it online. You can download it physically. So this is really amazing. I don't know if it was this you got or our branding essential manual. So this can also help. So look into invoice B. Or do you have any other suggestions that will help him as
I
well?
know that when I used to run my businesses, there were quite a few, but those are things you can actually Google. If you Google them, you find a lot of them, and you'll be able to, choose which one you want to go with, depending on the cost or what they do. This is B is free, right?
It's free.
So you know what? Even on your phone, if you're using an iPhone or an Android, in your Google Play Store or your your I app store. You just type in search words, keywords like invoice, invoice, type in invoice, type in um what was that,
Bookkeeping.
bookkeeping, type in book. You see a lot of those free apps to come up. That's how I used to do sometimes those days. I would just do that. And what that does is it gives you your financials. Some of them will even go as far as helping you, asking you questions like how much you sell, like they would help you break down those things so that you can see how much you're making and what your profit is. They will ask you how many people you employ, what you spend in logistics, running your business. You separate all those things. It will tell you your gain. It will tell you your profits. But I would encourage you to even go further than that, and on your own, keep your own record about your clients. This information is providing to you. Have a tab for that, but also have information about your clients. I like you to explore even if it's just two people that are your clients, explore them so much they feel so well
Like
loved
a
because
part
they'll
of
feel,
the business, a
yeah,
part of the family,
so
you
many
know.
questions. Constantly do surveys, ask them, since they're using Acronym, what are the specific things, and try to ask them questions that is easy for you to compute them. Like when you put them in Excel, it's easy for you um to to measure what they are saying. So don't try not to make your questions open-ended. It's easy for them to, because if you ask them open-ended questions, they probably will just get tired and not answer you most of the time. But if you put structured questions that say on a scale of 1 to 7, you need to just do that. It's more work, but it pays off. It pays off, and it sets you apart from just the regular small business, person.
He says, "This is gold. Thank you so much." He was asking, I think he has one more question. He's asking, logistics. Do you have any suggestion? How should she run her logistics as she brings goods from her warehouse? I think we missed this part.
Oh, okay. So in terms of logistics, what does she want to? Does she have specific people that she gets her business from? She needs to track what kind of products does she carry. She needs to be able to check like KPIs for who her vendors are, who she uses to transport her items. What are the things she's looking at to be able to say, okay, I'll go back to this person. This person's person that'll be helping me carry my commodities from warehouse or from point A to point B, because when I bring it back, they package it, the things are not squashed. Depending on what it is her products are. You're looking for someone that will be able to take your things and deliver them in the right condition at the right place and at the right time. You're looking for someone that you can ask them for information and they'll bring it back to you. You're looking for someone that if you send them surveys, they're able to respond to you, because you don't want people that they don't document anything. You don't want people that are afraid of paper when they see it. You want people that you can communicate with via email or digitally, so that you have record of of requirements that you're presenting to them. So yeah, that's a bit of what
Okay,
I've.
he says she deals with people in and out of the country, baby goods. I'll ask for info. I want to digitalize this information for her.
Okay, so she deals with those kinds of things outside of the country. Yeah, you definitely want people that will respond to you, digitally. People that when you send them, when you ask them, when you have requirements for how you're present, for how you're transporting your things, or what you want them to transport, they're documenting it, and they're confirming from you, so that you can say, these are the things that I itemize, these are the things. They are counting your things. They're not just saying, madam, we've carried it though. they are itemizing the things that you brought for them, and they are saying, okay, so number of this, so number of, because even you yourself, you might not be that detailed to do that. So you want people that go the extra mile and make you sit up in your business. People you can leverage, not people that you're teaching them their work.
Mm, mm,
And then you
mm.
have also need to have your own KPIs for the kinds of vendors that you want. What are the KPIs that you're using to track how much they charge, um what kinds of things are important to you as a business. So those are the kind of things you put in your KPI, so that, and they're aware of it, and if they fail at it, then you have good reason to call them out on it. They're aware of it. You sign a contract to them, they have contracts. The expectations are clear. The obligations on from both parties are clear.
Mm, mm. Okay, so he says digitalization will be a huge part for her, especially since most people shop digitally. So if a lot of people, so wait, so compared to people that actually come into the store and people that buy online, which one is more? Do you have more people buying online or more people coming into the store? Then I think at this point, I think you might have to. I think for me, the first step, apart from setting up setting up your digital structures that will include your invoice and all, is like maybe like setting up like a landing page or a website
Mm-hmm.
that
So
will
that
have, yes,
you
all
keep
those
track of that.
products.
Yeah.
Exactly.
Yeah.
Like a website, if you have a website that can take the order, a website that can track the order, a website that can take in your reviews, your invoices, and all that, I think a website is going to be, investing in the website is going to be like the very next step. And
Yeah.
coincidentally, I happen to build websites. I partner with a website, a web designer in the United States. And we do, if you've seen my website, you know that, we're not playing. So you can automate everything, even your people that assistants that will chat to people anytime they reach
Okay.
into you. So I
Virtual
think,
assistant.
yeah, a virtual assistant. I think a website, for me, I think a website, I think you need to invest in your business planner, right? And then I think you need to download Be Invoice, Excel, or I talked a lot about Excel. Documenting, okay, it might look like work, but even if it's one sale, I have like, well, let me open this. I want to show you. If you look at this, right, you can put your name, your business name, and then you turn, you see. Because from experience, I've done business over almost over 6-7 years. You put your income, you now start putting in your processes. There are lots of pages like this. There's a page that helps you okay, like this one. This is January, February, March, April, up until December. You write the year. So it's able to tell you, okay, in this month, this was how much sale I made. This was what I did. Was it a profitable month, or did I have losses and all that? It's very important that you document. So in a year, you can say, okay, for this particular product, this is the book that I'm going to use. And the interesting thing about this is that I'm a believer. It has 366. This is a leap year affirmations. So I know that a lot of business owners, we try to do it with our strength, with our might, but sometimes we need that divinity, that help from above
That's
that will
outside of
go.
ourselves. Yeah.
Exactly. So this has been very helpful. And one of the testimonials I'll give about this is that when it was still in, I hadn't even printed it. We hadn't even put it together. I just had 2-3 pages of prayer to activate angels on assignment. I prayed that prayer that night, on Wednesday night. By Thursday morning, I activated my angels on assignment. I sent them by Thursday morning already. I got a gig to speak at the radio station talking about Business Boost Boot Camp and advertorial for free. I did not pay 1 naira. I did not pay 1 CD. I did not pay 1 penny. So
Wow.
sometimes, yes, sometimes, we are trying in our minds, we are trying in our energy, we are trying our best, but all we just need is just that, breath of divinity, that angelic assistant, that boost and that push that would, maximize what we are doing and make our efforts, look like it's our small efforts look like it's a lot of, So I think Ben, I think he wanted to get it last week, but he ended up getting our branding essential manner. So still get this, you're going to love it. He says actually people come to the store that she doesn't have an e-shop yet. Good KPIs. This will be my first big project to set up a digital scene for her company. And yes, websites. It's as if this whole show was for Ben. Hey,
he had been manifesting. Now he's manifesting. He had been saying it probably.
yes, 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 yes. He's young and very, very creative, and he is, like the way I'm saying him, he's been following. He's one person that's been following the courses. I've been joining in and all that, So I really must commend him, and he stays till the end. In fact, after we end, even if it's 11, 12, he'll be my DM. Like, okay, let's talk about this. Okay, this. Oh, I'm working on this. I'm working on this. So yes. So Ben, I must commend you, and he's Ghanaian. He's doing so well. I can't wait to see how far he'll use all this information in the next 6 months. Yeah. So he said
Very,
this will be
very good.
my first big project. So yeah. So
Mm.
it's amazing. It's amazing. It's amazing. Any more questions, guys? Are we doing ChatGPT prompt tonight?
I don't know. It's already well past 6 p.m.
Mm.
Um, when does this end?
Team, this is actually the last day. It's supposed to be the last day,
Oh,
but
last day. Mm.
yes, but we have Thursday. Thursday is the 31st. So we might do one or two teachings, but like this is the last, this is supposed to be, our grand finale. Thursday will just be one or two teachings will just come up. And we are all coming live tomorrow as well
Yeah.
here. This is
Yeah.
like this is like the last, we're just like gradually easing out, you
Yeah. Well,
know,
anyway, we'll talk.
behind the camera.
Yeah, behind the scenes about the
Yes,
timing and
yes.
all that.
You see me, I've been pushing. I was like, everybody do your course, everybody do your coursework. At the end of the day, like I said, we have amazing surprises sponsored by Coach Ore. She has goodies for you. So if you don't do your coursework, we'll take you to the orphanage. So do, do your course. Anyway, some people have submitted theirs. Some people have submitted theirs. I think I'll check with Miracle how many people have submitted their coursework and done
Oh,
assignment.
oh, that's good. Okay.
Yeah, so some people have been submitting, but we need more. We need more people to submit so that we can say, okay, these people took this, they took it seriously, and we can now grade them and all that.
Well, that's interesting.
Mhm.
Um, the thing about this chat is going to take a while. I don't know if it's something I want to do tonight, and I don't really have. Okay, I have some data I could use. Um, so the thing, ChatGPT now is now actually to get the best out of ChatGPT now you have to pay. Before it
Yes,
used to be free. It
yes,
was
you have
mostly
to pay.
free. To
You have
get the
to pay,
best
or
out
you
of
wait for their system to boot to a certain point. So they'll let you know, okay, you've used up the
yeah,
point,
yeah,
point something
yeah, yeah,
capacity,
yeah.
and
Then
then
you
you have
wait.
to wait for
Yeah.
maybe like next 6 7 hours, and if you need to do something, and the fee, is it that much? Like, how much is it to pay for
Oh,
ChatGPT
no,
monthly?
actually, it's not that. I can't remember how much it is, but if it's negligible.
Hmm.
It's not up to $50.
Okay, that's not
Yeah.
bad.
No, it's not.
That's
It's
not
not
bad.
bad at all. It's not bad,
That's not bad
and it's
because
like an annual
it's
payment.
annual, so they don't charge monthly.
No, no. Oh, sorry. Yeah, I did annual, but you can do monthly. You can do annual. So annual will maybe be running into much more, maybe like two something. So monthly will
Alright.
maybe like 15. It's very negligible. It's not anything.
So
Yeah,
if
it's
there's a
not.
month that you have a lot of work to do, I think ChatGPT paying for it wouldn't be a bad idea.
So let me give you one trick I do for applications that I don't really want to pay for. You just
Oh yeah,
pay and then sorry.
give us.
It's not anything complicated, but you just pay and then like I will set an alarm on my phone to finish my work and then go back and unsubscribe after.
Oh, wait. Are you saying that like you put in
You
your
won't
credit
pay.
card and you do the
You
free
know,
one?
yes, they'll do 30 days, 30 days free trial. So I don't even remember if ChatGPT had a free trial. You know, they were free for such a long time. So
Mm,
they warned and warned us that they were going to start charging, and we're doing them emo until one day, all of a sudden, they're like, you use up your points, blah blah blah.
oh my
So
goodness.
yeah, so they're pretty, but they're also, aside ChatGPT, there are other platforms coming up that you can use. They are not ChatGPT, but I'm not sure how well they will help. But there are other artificial intelligence platforms that
Mm,
is free. Um, there's this one I'm looking at, Power Drill. It's the
power
only
trip.
problem is your data.
Mm.
The problem is your data, the safety of your data.
Another one is another one I know about Gamma, especially for coaches that are trying to do slides on the go.
Mm,
Gamma.ai. Oh my
mm,
goodness. Okay. You can just put in the words, put in the color thing you want, and then
yeah.
put in your script. It just turned it into slide, the cover slide. I'm like, it just makes everything easy. Do you also know that on WhatsApp, your WhatsApp
Mm.
has ChatGPT,
Yeah,
something
it
like that,
has
AI.
artificial
So
intelligence. Yeah.
thank you. So if you're on the go, you have a conference or something quickly, and you want even to if you want to generate images, just try this thing on your
Mhm.
WhatsApp. Put in generate images of in a black and white thing, African entrepreneurs. You put your business name. You'll be surprised. It will just bring it up. You put your color. Like if you don't put African, it's going to give you a bunch of white people. So it's always important. If you want it to be Afrocentric, if you want it to be mixed with Africans and Caucasians, but me, because I'm in Africa, I like to use Africans because those are the people that we have around. But if you're in the diaspora, and you want to you have a mixed audience, you can use Caucasians, Africans. But if you want to get an Afrocentric audience, just put Africans, put your color theme. Most times they misspell the name, but they'll always give you something similar that you can edit
Okay. So I just said that ChatGPT is like they charge you per day.
per
Is there
day.
like, yeah, like 19 cents or so per day.
10 cents is not bad. 10 cents is like how much? How many naira? Like 100 naira or so.
Yeah. For the number of days that you need it. You can actually skip it. So I'm using another account right now to
Yes, that's another. You
I'm
you
using
stayed
another
in
account.
Onitsha. You stayed in Onitsha too long before you moved to Lagos. Hey, God, I've done this. So God forgive us.
No, but they know that you can do it now. That's why but they're hoping that you like them so much
That
that
you now pay.
you'll now pay.
Yeah, we have so many apps. We're paying for Canva. We're paying for Zoom. We're paying for StreamYard. We're paying. We're paying for so many apps. But
Yeah.
these apps, they make our life easier. And when it comes to like, I saw someone asked me some questions about editing the other day, and I really wish that she was in this live. But when it comes to editing, what are the best apps that you would suggest for people that want to edit like video
Canva.
content?
Oh,
Canva.
video content. Video content. Yeah, well, I don't know that video Canva does. I thought you were going to say document, but video
Documents is
content.
definitely Canva. Flyers,
Yeah,
Canva.
yeah, I use Canva a lot. Um, see, let me tell you the truth. Just use AI. The only
AI
thing with
can edit
AI,
for you.
yes.
How?
So when you go into, say, ChatGPT, it has a image generator, or you, if you do that, like if you go into um your your AI and you click on the image generator, it's going to give you opportunity to to type in what you want it to do.
And
Like
you
you
can
can
tell it
tell
to
it,
edit.
you say the specific things you want to do now. You tell
And it
it,
can make videos for you.
yes. There's even there's this one I
Really?
use. I don't remember the name. There's one I use to um there's one I use to upload things on YouTube. I don't remember the name, but it's AI as well. You create an
Is it
account.
Opus Clip?
No. Um I don't remember the name. It was open on my system for a long time. You create an account, and then you upload your video. No matter how long your video is, you can tell it the voice to use. You can tell it the you can tell it
Mm.
the accent to have. If you want British accent, if you want a woman's accent, you can tell it the inflection of your voice. Like you want it to sound sad, you want it to sound sober, you want it to
Please, you need
sound
to remember this app.
funny.
Really?
It's so crazy. You want it to
Wow.
sound like an African angry woman. Just type it in.
Why don't they have
ChatGPT will be
American
able to.
Angry? Are you
They have
serious?
they have anything. Type it in. They have options, but you can also choose to type in what you want. It
And
will
let's say you
run
want
it.
to do like explainer
If you
video,
don't
all those
even have
videos.
a video, if you don't even have a video, you don't have a video, you have a script. You want to now present
Yes.
it, upload it on YouTube.
Mhm.
Just upload your script, then tell it the kind of video you want. A child
Are you
playing or
serious?
something funny, it will generate it. Then you can keep adjusting until it's perfect. You keep,
Is it
let me check the
God, it's
name.
coming to my mind. It's kind of purple. The interface is a bit, it's kind of purple.
I think so. I think it's
Purple, bluish purple.
purple.
Uh
In
trying to
video.
remember it's flashing
It's the
in
name is
video.
in video.
In
In video
video.
AI.
In
In
video.
video AI.
In video.
In video AI. Yeah,
Let
it's
me
really
check.
good.
In
Like
video AI.
just
I'll check it out.
so, but it will have your it's their watermark on your product unless you pay.
Unless you pay, and the price is how much?
It's about $40 per month, for something dollars per month, and
And they have the free trial period, right?
yeah, they
As
have
well.
free trial. Yeah,
In video
it's
AI. I
good.
think I just saw it.
Yeah,
I
it's
just
really
saw it.
good.
And then let's say I wanted to do like an explainer video, like video animation, like
Mm.
someone is drawing,
Mm-hmm,
writing
mm-hmm,
and all that. I can
mm-hmm,
do it
mm-hmm,
here too.
mm-hmm. Yes,
Really?
you just tell it what you want. You tell it what you want. It will keep adjusting it. There's so many components to it. Yeah,
Mm.
I don't even think I've finished exploring it.
Let me download it because I need to. Oh, I love things like this. You see why you shouldn't miss any of our trainings. People that are in the comment section, you see why. Go and download invideo.ai if you want to get all these videos like Ben. What you're trying to do, you need explainer videos. These are where you can do it, where you can create it. Oh wow, I just found it.
Hmm.
Is it available for Android as well?
I think so. I usually do it on my laptop.
So you can do it on your laptop.
Yeah.
Nice, nice, nice. I'm downloading it right now. This is amazing. This is amazing. So let's talk about prompts. Before
Mhm.
AI came into, before we started, before we started using, I'm trying to get the comfortable position. But before we started using, AI, Chat GPT, and all, a lot of us used to just sit down and think. A lot of us are very creative, but now, ChatGPT has made it easier. So when it comes to this prompt, I want to ask two things. One, how do you use ChatGPT without losing your own cognitive thinking, without you losing your own creativity,
Creativity.
without, yeah, without depending, because some people have said some things like, like one day when they get everybody hooked on AI, artificial intelligence, they're going to yank it off. And then people walk around and not, no,
That's the lie. They're making
no,
too much money from it to even do that.
I know, but they were saying, like, for instance,
And
let's
and
say,
that, and there are too many things that are dependent on artificial intelligence. People
intelligence,
are
yes, but
working to latch
to
onto artificial
replace, yeah,
to
to
work
replace
on it. So how would it? Yeah, they're not creating it for even me and you. They are creating it for much bigger things like genetic what's it called,
mutation.
mutations. It's bigger than just me and you. Me and you are
Yes,
just leveraging on what those things. But
on one of the, but like I've said, like, what if something happens and we don't have access to AI
so the
anymore?
truth is, if you use AI for a lot of things without using your own creativity, people will know.
True.
So what you do is use AI as to cut the time short that you need to think. AI will produce what you need. Then you now go and finish it up. Because as much as people think is artificial intelligence, it is not intelligence on its own. Yes, there's a lot of predictive data modeling that goes into it to make it improve its smartness as it goes on. With the questions people are asking, it is increasing its smartness. Yes, but it can never be as smart as a human being. It doesn't have it can't do anything except by people. It's
Mm,
leveraging. Yes, it does a lot of predictive improvements, but it's still leveraging because it's leveraging based on information that is out there. Because we live in a global world, and it's leveraging on information data. It's going to Twitter, it's going to all those places and scanning all that data and processing it pretty fast to upgrade its smartness, but it can never be as
mm,
smart as you. So once you've leveraged it, it's helping you to cut short the time that you use to come up with ideas. So it gives you ideas. Your role is to now take it a step further, look at it and do
humanize it.
what is really in your mind. Because really, those prompts, sometimes you don't know how to. Sometimes you ask ChatGPT all these things, some things. It's getting smarter and smarter. But I remember when it first came out, there are some questions you ask it and it will be confused and it will tell you, I don't know. It's getting better. It's
No,
much,
me,
much
all right.
better.
There are questions that ask ChatGPT,
And he
and
will
ChatGPT
tell you, I don't know.
tells me,
Do
tells
you
me.
see what I'm saying?
Yeah,
If
yeah.
you so what you want is really in your mind, but you just keep putting in prompt to see. That's what they're asking you. Is this how if effective was this? Whether you say yes or whether you say no. Because when you say yes, it's going to take your yes and use that method to answer other people's and use that method and process responses. If you say
Interesting.
no, it cuts it. So what me and you will do on our Excel and it will take us 24 hours to do is doing it within in milliseconds, and it's getting faster and faster. That's really what artificial intelligence is about. It's not that it's not that smart. It's really just
Mm,
leveraging all the information out there.
existing.
Is only as smart as what the human race has achieved so far. The only thing
Mm,
is processing information, millions and billions of information on a particular subject based on keywords
mm.
that you choose within nanoseconds. That's why it's
Wow.
better than human beings. But you're leveraging that, but it's not the solution to your creativity. It can never replace your creativity. So when people say it will take away jobs, it's not taking away any job. It's just going
Mm,
to change the way that we work. in that we will learn, we'll work faster, like what we're saying about creativity. We'll work faster. And so it will mean that if you're not able to adapt, if you don't have these skills that I'm telling you to learn for digital transformation, you'll be cut out of the job market because they can't use you. You can't do anything. Oh, what are you going to do? Be talking. But there are lots of things that artificial intelligence can never do, and those are the jobs. That's how it will change how we. It will change how we work, but it's not going to take away our jobs. Except you're not learning, you're not improving, you're not getting more technical. You're not improving your soft skills, your social skills. Those are things that are becoming very essential to the everyday upwardly mobile young person.
Hmm. This is so helpful. I'm trying to share Ben's comments. You
Yeah.
know, um, says digitalization will be a huge advantage for her. Trying to sharing good KPIs, like his comments, his inputs are really amazing, very encouraging.
Mm.
Says this is my first big project, set up a digital scene for her company and all. So this has been a really, really great night. First of all, we started by the first segment. It was interrupted by the power, the light. We call it light here in Africa. The lights, the lights went off, so we had to go and come back. And then when we came back, I just started. I got the materials from endocrinologist Dr. B. Onyenekwe. He worked with my grandfather on the iodine project. He's alive and kicking, and he was supposed to join us today, but he wasn't able to. And also, I took the liberty of delivering the slide. Like the whole course of this, I was saying I am not a medical doctor, in case I murder some names, but you can listen and you understand because I broke down a lot of the things, broke down the iodine laboratory, the one that we are working on building. We've gotten the property, and also the iodine library as well, like a dynamic library that you can go in and get materials with regards to IDD and all we've done. Then I think I talked about that for like over maybe 50 minutes, an hour before, Coach Oroluwa came in and wowed us with digital transformation and this wonderful, prompts and cheats to ChatGPT that we can also leverage on, and she'll be coming again tomorrow. You'll be saying, oh, because she's my friend, I'm bringing her every day. Yes, get you a friend like me. So people to make good friends in secondary school, you are busy jumping fence and window. Me, I made good friends. And they are here. We are busy entry uncompleted buildings. For you, we are we are making good friends. You're the one person that I would always like when we talk, like we are like no forming. We are like
Yes,
I'm eating a bar right now. You know,
drinking Gary.
I'm drinking Gary with
Cassava
coconut
flakes.
and cassava flake. Like we're not even like it's real. This is my course. Oh my god, I'm scared. Or I'm having palpitations. Like you do like that. You need to in your life in business. You need to have people you trust. Talking about relation, you need to have people you trust that you can tell as if they pay you. As if not every time you package, or people will package and they'll just you will not know what is doing them. There should be people. There should be people. Then you should be people you can open up and say, this economy, this thing, this course, this thing. Like there should be people, good friends that you can trust in. People that your spirit is not, because the truth of the matter, your spirit will always guide you. If you're around somebody and the person is iffy, your spirit will always warn you to, distance a little. If you're around good energies, it will always get you closer. They'll be supportive. They will not second guess your pro. They will not discourage you from what you're trying to do. They will actually encourage you to do more. So yes, it's also, get you people that are on the same wavelength, on the same people that are running the race like you know, is very, very important. People that, in fact, as you're taking courses, grab your friends, because if there are 5 friends, right, and only 2 people are improving themselves, and the other 2 people are in uncompleted building doing things that I don't know about, right? At the end of the year, those 2 people can't even you can't, a year is too much. Like, you're not speaking on the same level. Those ones are talking about activities in uncompleted buildings. You're talking about how to advance yourself, digital transformation. I want to build a website. I want to, digitalize my processes for my family members' businesses. I want to write a book. I want to teach a course. You're no more on the same level, especially even in relationship. In You have a spouse, as you're learning, carry the other person along, so that you're both learning together, so nobody will be left behind when one person is speaking yesterday's conversation and the other person has already gone into the AI, the future, digitalization, futuristic conversations and all that. So, the best thing you can do is, as you're getting empowered, empower those around you as well, so that you're in rooms that would present more opportunities, and then you can also collaborate and work together and grow. I think that those are my words, with regards to what you talked about. And I'm so excited because today there's a book I wrote, which was the I wrote it's called Branding Essential Manual, and then I've been working on the workbook. I have been getting pre-orders on it. I want to show you. Branding Essential Manual is on Seller, it's uploaded. Okay, let me see, hold on. Okay, let me add to stage. I love this StreamYard. So this Branding Essential Manual is, is a 28-day guide. I feel, even, in whatever you're doing, if you can continue with a habit for 28 days, you're going to, for even, no, 21 days actually, is going to become a part of you. 21 days is, the duration that has been proven that you can learn and get used to a new habit. That's why our NYSC was 21 days. You remember, we stayed 21 days in camp so that you can.
Oh, yeah. Oh, was that the
Yes,
mentality there? Okay.
that was the mentality. 21 days for you to build a habit, 21 days for you, to get used to a particular, pattern.
Way
So
of
they
doing
woke us up.
things. Yeah.
Yeah, they woke us up with a bagel, in the morning. They let us jog very early. They made us, exercise. They made us take drills. They made us move under the rain and in the sun while we're singing our anthem. They literally programmed our minds for whatever the future, held or holds. So, but this is a 28-day, because ideally months are supposed to be 28 days. So this is a 28-day branding essential manual. And for 28 days, if you follow it every single day, it has a task. And I created it for the Gen X, the Gen Y, and Gen Zs. We are the Gen Ys, the millennials. So I realized Gen X, they are fast coming into the business scenes, because Gen X are the saucy ones, are the ones that can't, like, if you give it to them, they'll give it to you generation. So millennials are already doing business. The Gen Zs are already in business. So, I've made it for the Gen X's, Gen Y's, Gen Z's, and it's a whole book with 28 days. It puts you through, you have the you have day one. I don't know if I've moved into, okay. This thing doesn't want me to show. You have day one, talks about, okay. I did a lot of background work. I talked about the 8 Z's of branding and all. It's a very rich book. It has case studies in it. It has different activities and terminologies and then we go into. I wish I could do a preview of the book. It has the 12 P's of branding that you can put into your business. Then it has day one, where it references, and then it now moves into the day one, day two. Day one is understanding branding basics. You need to understand, you need to define your brand purpose. It has activities. So this has been there, it has been selling. But why I'm really excited, John Rose, is that
Mm,
today our branding essentials workbook. This is, I've been waiting, people have paid for this, and I've been working on it. And the branding essential workbook works alongside with the branding essential manual. So with this, right, you can like, it gives you task. Okay, so instead of just, so in the book we're telling you do this, we're giving you the explanatory aspect, but the workbook gives you the work that you do for your business. So I'm very excited. It has your introduction, understanding branding, the branding worksheets, the evolution of branding, core elements, branding strategy development, branding identity communications, brand identity, more on that, brand development, brand management, building your visual identity, creating a compelling brand. It has different worksheets that will enable you as a business owner, So I'm very proud of this. And I was telling my team, I was like, we need to have this ready today. I don't know how you're going to do it, but we need to have it. A whole is a whole is a whole lot. Is a whole lot, but I am glad that it's here. The next book that is coming out is My Business Web Model. And then another book that I'm working on is my Customer Service Pro. So these are the two projects that I have on hand. Ben, I can see you. Miracle, I can see you. Oh my goodness, Ore. It is well. It is well. It is well.
it's
It
been
is
a,
well.
it's been a very good, it's been a successful 30 days, right?
Yeah,
It's
31 days.
been,
It's like October is 31 days, right?
yeah,
30 days, September, April, June, and November. It's November that has 30
it's a
days,
one day.
31
Yeah.
days. So out of these 31 days, we've thought for 12 days. I think this is day 12.
Mm.
Then day 13, if we still have spillover courses, but we have a coach from Abu Dhabi that would like to teach as well. So we're going to see if we can fit him in. And then we also have a coach in Nigeria that wants to take, is it how to access loans as an SME. So I'm going to see if he's available. I'm trying to put all I can, within the confines
If you,
of the course. Yes, so that anybody that comes in, and wants to learn, they can just take their time and just, pull out the items and that they need for their business and for their, you know, and then just fly with it. And don't forget to drop a review and follow us at the end of the day. So it's
yep,
been a good one. It's been a
yep.
good one. It's been a good one. It's been a good one. It's been a good one. So what are your next project? What are you working on? Do you want to share with us?
So right now I consult um on technology processes, implementing technology processes, improving technology processes, creating new technology systems and processes for banks, mostly banks, and a few other um, businesses, but mostly banks in Canada. I'm working on, starting to help small businesses. I've worked with a few small businesses in digital transformation, because a lot of small businesses feel like it's not for them, and believe it or not, they're quite. The problem of not non-digitized processes or a non-digital system exists all over the world for small businesses. And that's something that I'm targeting and I'm working on, so that, because the goal is, we don't want small businesses to fall off the face of, global markets. Small businesses are the driving force of most economies, and we want them to be able to latch into these small businesses. And in that knows, my passion is not small businesses that have offices or a few branches here and there. Small businesses for me are people
Like
like
micro, the market.
the smallest people, that you can even use your phone, looking for ways for them to improvise in how to digitize, and all the salons, people that you wouldn't even necessarily think of when you're thinking about small
Yes, then.
businesses, not those medium enterprises, tiny micro businesses. So I'm looking and working with them to organize, to just digitize their business. I've worked with a few, so I'm also working on creating platforms, to help create this awareness, to create the zeal, the drive, the understanding of what digital transformation is for them. So yeah, that's what I'm working on right now.
Yes, that's an amazing that's an amazing project, because these SMEs, the micro, like they need help.
There are
They
very
need
few people targeting that sector, because everybody just talks about SMEs, but
yes.
the lower than, like, smaller than small,
Yes,
those
because
are the ones.
imagine you go into like the salons. Imagine all the salons, all the salons, all the small shops, all the the places, like you said, that a lot of people don't reach out to. Imagine each of them being able to have correct, bookkeeping systems.
Mm-hmm,
Imagine them getting access to, funding,
mm-hmm,
that they can,
mm-hmm.
boost their business. Imagine
Yeah.
them getting access to, materials that they can
Mm-hmm.
use. Let's say
That's
maybe
right.
like a a tailor, for instance, a fashion designer. Imagine you saying, okay, we're going to sponsor. What is your next bill? What do you need? And they tell you,
Mm-hmm.
okay, we need one new sewing machine. We need about 30, 40 new fabrics. We need. Imagine being able to give them these resources, as
Mm-hmm.
well as
Mm-hmm.
train them, so that
Mm-hmm.
they know that, okay, we are here to help. We want to train you. We want to empower you to do your bookkeeping properly. How to interact with customers. A lot of this business, a lot of them don't know how to talk to customers. I've gone to shops, here in Accra, and then they're talking over your head you know, in one of them, I told you, one of them nearly broke my phone, and she didn't even turn back to say sorry, and I'm like, so
Mm.
because they are small businesses, you make excuses for them, but for how long? How many people will you rub off the wrong way if you want to have a good business?
The truth is, so most of those people um don't have training, and the trainings available is outside of their budgets, because most businesses starting doing those kinds of making those kind of trainings available
What do you need
are
for SMEs?
pricey. Sorry?
I do need for SMEs. I do need for
I
structured
do need
business.
for structured businesses that
Yes.
even understand what this is for. You have to do a little bit of convincing to teach them, and then there's already a boundary against them, because the money is too much.
And
When
there's
you look at,
already an educational gap. So
there's
you're
already
coming
an
to them,
education.
and you're coming
You're
looking like a
speaking
professor
above
of
their head,
glasses. Do you
intimidating
understand?
them, speaking very.
Yes, you're wearing the high heels and you're talking to market women. Like, you're not even serious. If you want to do that,
They
you dress down. You know that you dress
shabby.
uh, flabby. No, you dress smart. You dress. If you want to, if you need to tie. I learned this, going for all these public health conferences. They remember, if they are going to the rural areas, like, they will tie wrapper or wear a
Mhm.
normal
Yeah,
skirt. You will not
yeah.
see them wear suits and be going into
No.
the
Wear
forest
your
to no.
jeans and your t-shirts
Just
and
look simple. Wear your
and
corporation
speak
shirt.
don't speak be speaking English. They don't even
Make
need to
am-
understand what you're saying. The minute it starts looking, they'll think you're just trying to come and show for them.
They'll just sit down and
They
just
will
do.
even be, they might even be friendly with you, but they won't take you seriously. They won't
They'll
take it
just sit down
seriously.
and just do and do. I'm
Mhm.
shouting exactly, exactly.
And then they'll even turn it into a joke. But you know that they are laughing at you so that they can entertain yourself and you will carry yourself and be going.
Carry yourself and
So
go. And
it
they'll be
won't
saying, and that
build anything.
market time is passing. They want to go and sell their market because
By the time you sit down there for 2 hours, achieving nothing because as the customers are coming, they are going.
they're
Because
going.
you're not
You
passing
should
any
be able.
message. The minute
Like
you were start speaking supreme, it's tuned off.
exactly. So these communication gaps, it has to be filled.
Address,
These
yeah.
people are not on YouTube. They are not
Mm-mm.
on Facebook. It's their children that are
Mm-hmm.
on this platform that will now learn and be like, okay, mommy, I learned this. I'm going to do this for you or no. But then, like when they come back from selling, they want to just take a shower, watch some
And
TV,
sleep.
and sleep.
Mm-hmm.
So if there's an initiative, you have to go to the grassroots.
Mm-hmm.
And as we are saying this, from the depths of my heart, I'm appealing to government. The government. I'm appealing to other NGOs. We have done a training for a whole month, right? We are passing the baton on to somebody else. There are over 350 people in our community, as you can see in the WhatsApp group. Sometimes we have to shut the communication in the group so the messages are not too much. We are passing the baton to the government. We are passing the baton to the minister for agriculture, the minister for empowerment, the minister for, like, they need to do
Technology.
something. Yeah, we've done our part. We are doing what we can. We'll still do our outreach. We are working on our materials that we're going to use and go. We're still calling on volunteers. We'll still do what we can for some of the businesses in the community, but there's only so much we can do. So if there
Mm-hmm.
are other people that would like to pick up from where we stopped, this is us, saying, if you want to work with us, reach out to us. Like you've seen already, she's really passionate. Like this is something she does every year. She reaches out, to the women in the market. She empowers their business. This is something she does. It's not like she's been doing it, I think, for 1 or 2 years now, if not
Yeah,
more.
so
Yes.
yes.
So yeah, 2 years. Every year she makes out time. They go into Lagos, they reach out to different, at least 50, 20 to 50 businesses, and then they boost their businesses, and all that. So I usually come at it with, I like to train. I love to teach. I've been teaching since God knows how long. While in university, while I was working in radio, I was also teaching in a elementary school. Then we started our own school 2014. So I love to teach. I teach business, I teach branding. I definitely love to teach, and I believe that if you're giving someone, an olive arm, you're giving somebody knowledge, and you're also not just speaking, you're also backing it up with support. It is going to go a long way. And in the next 5, 10 years, we're going to see the difference. We're going to see the difference.
Amen.
So amen, amen, amen. So any more input before we call it a night? Because we need to go and get ready for tomorrow. As much as I want to stay here and talk and talk and talk, but I need to go. And then also there's an art exhibition in Accra on Saturday. On Saturday, part of the organizers is Rose Dream Art Exhibition. It's her first exhibition ever. So if you're around, if you want to send in people, free entrance, free cocktails, free vending, please reach out. Free vending, but you have to give us like a certain percentage when you make sales. But it's like a free for all platform. There'll be music. Come and relax on Saturday at A&C Mall. So if you're a vendor, you're interested, send me a DM. If you want to just come, register. The link is free and all. So I think at this point it is almost 11. So I think we'll call it a night. Thank you so
Thank
much.
you
All
so
right.
much. Yeah.
You're
Thanks for having me.
welcome. Yes, yes, yes. I can't wait for tomorrow. I can't wait for tomorrow where we're going to have, the conversation with regards to I'm going to bring all the coaches here, God willing, and hopefully the light permits as well. We're going to do it tomorrow and then, just have one more day, which is Thursday, and we sign off nicely. Do you offer consultations for SMEs and business owners that like to consult with you on digital transformation? Is that something you
Yes,
do?
yeah, that's
Okay.
something I do. Yeah, for sure.
Okay. How do you have an Instagram page? I know your Instagram page, but do you have an like a professional, like an Instagram page or anywhere they can reach out to you on? You
So,
know.
um, you can reach out to me on an email. I have an email. So before now, I've just been doing most of the action. I haven't really been doing most of the admin. So I'm setting that up. I'm working on that now. But you can reach out to me on my email. I'll share my email with Ndali, and
Okay.
you can reach out to me on that.
Okay. All right. So, in case you like a consultation on how to digitally transform your business, in the community, I'm going to be sharing the email address. And hopefully, maybe when I get it, I can also attach it to this particular live. So you can reach
Okay.
out or always just reach out to me on Instagram and say, oh, you need a coach, you need a coaching session from Coach Ore on digital transformation. And then I'll definitely direct you and all. All right.
Okay.
Okay. Thank you. Thank you. Thank you. Thank you. It's been a pleasure. I'm calling you after this live.
Okay. All right.
All right, sis.
All right. Bye, everyone. Thank you so much.
You're welcome. You're
Okay.
welcome.
Bye.
Okay, bye bye. Bye bye bye. Okay, guys, it's been amazing. Day 12 concluded. If you listen to the beginning of this particular live, the first half, like I said, the light, the power went out. We call it light here in Africa, and we were thrown out. But thankfully, I believe it was able to save. But I did a quick recap when I came right back, and then I presented the slides of Dr. B. Onyenekwe. He is an endocrinologist that worked with Professor Louis Honora Victor H. my grandfather, who is in the person of Mr. Iodine. So I presented it. So if you can catch, like I said, I'm not a doctor. I am a media person. So, and I did the best I could to translate what he presented. If we're still able to get him to come and speak again, we would be delighted. So I want to just use this as a medium to thank everybody that joined in. I want to thank Ben for his wonderful questions that he asked with regards to what we're doing. I hope you were able to get all the answers that you're looking for. We still have our outreach. We still definitely have our outreach, and we are working towards it. This month, we've been able to do some work in Anambra State, fed over 400, children. You can check with Red Cross, let them know from Louis Loveness Foundation, the Mother Bears, right? You can also check at Abakoba Park. We did some work in Otuocha as well. The work is on. The work will keep on going on, and we are not stopping anytime soon. So we're reaching you live from Accra, Ghana, Louis Loveness Foundation, chairman of Louis Loveness Foundation, me, Dali Modebe. I want to say thank you from my mom, Professor Kuma Modebe. I want to say thank you from Sir Sam Modebe Foundation, which is my father's foundation, Sir Sam, Modebe. I want to say a big thank you to our sponsors. I want to thank our sponsor, one of our wonderful coaches, Ore Oluwa. She just taught on digital transformation and chat GPT. I want to say a very big thank you. I want to say thank you to System Digits, Don Francis. Thank you so much. God bless you. I want to say thank you to Honorable, all the way from Abuja, in the person of Igwe Nike. I really appreciate you, sir. Thank you so much to all the wonderful coaches that have been a part of this process. I appreciate you. Thank you to my community manager, Miracle. Thank you so much. You have really held the fort. We are almost coming to an end. Thank you, and God bless you for all you do, and all for those praying for us, wishing us well. We appreciate you as well. For those that want to sponsor and don't have the resources now, we pray that resources be made available to you. And those that are praying for us, may God also, bless you in many ways than one. So I want to urge you to make sure you don't miss our live tomorrow. I'm bringing in about 6 to 7 different coaches, and we are going to be here. We're going to be here live. We're going to be here live, and I'm going to see if I can play you the video. We're going to be here live, and we're going to be having conversations with regards to Project Steam, right? So let me see if I can pull up the video. Just give me a minute. Let me see. Or rather, if you're on Instagram, why don't you just go on my Instagram page at Ndale Modebe? I'll put it in the comments. If you go on Instagram at Ndale Modebe, you will see the video at Ndale Modebe on Instagram. You're going to see the video. Is the very last video I posted on my page before going live. I'm going to put it on the screen right now. All right, guys. Thank you so much. Like I said, you don't want to miss any day in this week. You don't want to miss what we have for you on Wednesday. We're going to have the coaches joining live. It's going to be dynamic. We have coaches joining in from all over the globe. US, Canada, Ghana, South. We have coaches from everywhere joining in tomorrow. So you don't want to miss tomorrow's live session. You don't want to miss it at all. And then I'm very delighted to announce that my Branding Essential Workbook is ready. The Branding Essential Workbook is ready. The Branding Essential Workbook is the sequel to my Branding Essential Manual. This is my Branding Essential. I'm trying to get to the very first page of my Branding Essential Manual. It is like, hey, if you're a business owner, and you're having struggles with regards to setting up your business properly, oh my goodness, then this is what you need. You need a guide with regards to branding. If you want to get a day-to-day guide on what to do with your business with regards to branding, this is a 28-day branding essential manual, and this is the book. It came out, shortly after business boost cyber resilience boot camp. It came out in July. It was released in July, and then so far we've gotten so many wonderful reviews. You can download it. You can get yours on Seller. Go to my Seller account. Click the link in my bio on Instagram. Go to my Seller account and get yours. And I'm so delighted that today my Branding Essentials workbook is ready. My Branding Essentials workbook is ready. And I'm not going to lie, like, this is the workbook that you need. It goes alongside our Branding Essential Manual. Okay, so you've gotten the ebook, you've gotten the Branding Essentials Manual. You need the workbook to go alongside. Okay, so you need to build your brand, you need to choose your colors. This is what you need. This is the action force. This is the verb. This is the action part of the Branding Essential Workbook. So please make sure you send me a DM. I'm going to put it up on Seller shortly. I just brought it to you as it dey hot, as it dey hot. You don't want to. You see this manual, you see this workbook, you don't want to miss it. You don't want to miss it in any way. You don't want to miss it. So please make sure you get your branding essential workbook alongside your branding essential manual. It is loaded. It is loaded. It is loaded. And then if you buy both of them, I'm going to do a 45-minute, session with you while I look into your business and then look into the book and how it can apply to what you're doing. And this offer lasts till the 7th of November and then it's off. Thank you very much. It's always a pleasure spending time and space with you. I look forward to seeing you again on Wednesday for our conversation with the coaches of Projects team. I look forward to spending time and space with you. Make sure you subscribe. If you're not subscribed to my YouTube channel, I will just cry for you because I know that you're missing. So hit the subscribe button, watch our videos till the end, pick out the meat of what you want. If you have questions, make sure you drop it in the comments as well. If you have comments, drop it as well. If there are topics you want us to discuss, on business and all, drop it as well. Like I said, we are here to help. We are here to give you knowledge. We are here to teach you and all. So thank you so much. It's always a pleasure. It's always a pleasure. To people on Instagram, people on Facebook, people on YouTube, I want to thank you for watching to this point. We've been finding it difficult posting these videos on Instagram for a while now. So, but if it doesn't post, you can always catch it. You can always grab it. It's not catch, you can always grab it. Like grab it. You can always, grab it. You can always grab it on YouTube and Facebook. Grab it. Drop if you listen, right, and you listen to this point. I want you to drop me like 5 fire emojis in the next 24 hours. Drop me 5 fire emojis. If you're listening to this point in 24 hours, drop me 5 fire emojis, either on Facebook or Instagram or YouTube where you post. And then I have a surprise for you. Just let me know, Coach, I dropped 5 emojis. I know what to do. 5 represents something interesting. So I need to go. I care about everyone. I love you. I want to see you win. I want to see you at the top. If you're not in the platform, if you're not on Projects team, make sure you join. If you have not done the assignment, make sure you do it. It gets why. Okay. And you don't want to be the person that say, oh, I wish I did, when, the time was too late. So thank you and God bless you. I'm going in about 5, 4, 3, 2,